Hey everyone, I'm Regina, and I'm working on Mendü with my co-founder Demi. Mendü is a digital therapeutic for underrepresented women to manage their mental health. And we started to work together in early 2020 after we realized that we had a shared experience where we both worked with therapists who didn't understand our cultural background. And then on top of that, specialized programs for people from underrepresented communities had really long wait lines.
Women of color, women with chronic health conditions, and queer women are the most likely to struggle with their mental health. Just think about trailblazing women that we know, such as Naomi Osaka and Simone Biles, who are at the top of their fields, but still struggle very openly with their mental health. So I think most people are probably thinking, how could this be? Well, the truth is, no matter how many resources that you have, marginalized women struggle significantly with their mental health compared to their counterparts, with mental health challenges being 70% more prevalent in women and 88% of those individuals belonging to a marginalized community. So it's no surprise that mental health is a struggle. And these struggles encompass everything from access to stigma to lack of inclusion. And knowing all of this information, mainstream services still are overlooking these communities.
And that's why we're creating a digital therapeutic for us. Our goal is to create a mental health care system that recognizes that not everyone experiences the world in the same way and is inclusive of those differences. The way we're solving that is by creating a product with targeted tools and exercises for women of color and LGBTQ community, so that they feel empowered about taking charge of their mental health, because a lot of us are struggling, and our goal is to allow people who look like us to celebrate life together too. The way our product works is that the user will pick a problem that's bothering them, and our app will then ask guided questions on that problem that the user can respond to verbally by recording their answer. We wanted to make it as much as like a normal conversation as possible. And we came to the solution after interviewing and doing focus groups with over 200 women. And we're really excited about doing this because digital therapeutics have already proven capable of managing mental health. And now we want to make them inclusive of people who look like us as well.
And so we're actually in the market right now. We recently released a beta app, and we've already been building and nurturing community through strategic business partnerships and through group mental health experiences, which you can see in those images. And so we also perform community needs assessments, and we're currently conducting a longitudinal pilot study to prove the efficacy of our product, partnered actually with CUNY. And so this is all of this is what sets us apart from other companies within this space, because we're dedicated to not only research, but also inclusivity. So let's look at what our real users are saying. Look at Queenie, for example. She loves working on problems such for representation burnout, and that help her process poor experiences in the workplace. There are hundreds more just like Queenie who are having similar experiences on our app since launching in March of this year. So let's look at where our business is at. This year, we launched our beta product with a goal to reach a milestone of 5,000 users with a full product launch by the end of this year. And in 2023, we're going to also work on optimizing this B2C business model and start investigating a provider platform, which we'll get into in a little bit, to broaden our therapeutic reach to our users. Now, this market as a whole, the women's digital mental health market, is rapidly growing, with all major trends pointing towards the need to disrupt this community using technology. And we know this because this market has surpassed previous compound annual growth rate predictions, and we are seeing this market saw an over 30% growth since 2018.
So as Demi mentioned, we're going B2C direct to consumer at the moment, and that's because that's just allowed us to go into the market and get feedback from our users. Long term, however, we do want to pursue a B2B2C model, and that's where our users would get our product for free from their healthcare providers because it's covered by insurance. And we're really excited about doing that, partnering with insurers such as Health First, because it's going to allow our product to be a little bit like a clinical bridge between patients and clinicians. Because as patients use our products, that just gives the clinicians a lot more data over time to come up with treatment plans that have a lot less bias, and they can intervene if there's a crisis. So it's safer as well.
Overall, we're a team with unique insights to science and behavioral health who are about to transform the mental health and wellness space. So we are looking for collaborators in app development, research, and our digital provider platforms, and we also want to talk to those such as Dr. Bean to see how Mendü can be even more responsive to our communities. And we're also looking for equity investors to raise capital to reach our next milestone. So feel free to connect with us through any of these means to learn more.
Thank you.
Thank you so much. Really appreciate the work that you're doing. Thank you so much for the presentation. We're just going to move on to the next judge. We have Norbert Sichon.
Yeah, thank you both. This is great, and it's always so great to see that more and more ventures are working on this specific issue. Speaking to that, I'd love to just if you can maybe frame a little bit how you differentiate yourself in the increasingly competitive landscape here. There's folks like Health Near Hugh, I think Liberate, Ayana. There are quite a few that are working on this, thankfully. So I'm just curious how you position yourself among those.
Yes, sure. So as you mentioned, the space is pretty big. You have everything from sort of meditation apps to things that connect patients to clinicians. I think that we see our direct competitors long-term as other digital therapeutics. So that would be things like pair therapeutics, for instance. But while we're B2C, certainly our competitors would be things like Shine, so fully digitized products that focus on problems that concern us, basically. But yeah, we're probably a little bit different from the types of product that connect patients to clinicians. We are more a product to be used in between sessions with clinicians long-term.
Thank you.
Thank you. I think just similarly echoing what Norbert said, this is obviously an incredibly saturated space, but I also think that for better or worse, your opportunity to complement or supplement other work that folks are doing creates an opportunity potentially to sell to, market to clinicians as well to complement their work. That's just more of a comment. I guess in the meantime, because of the saturation in the market and relative newness, the $38, is that $38 a month or $38 annually? I forget what that slide said. Annually. So I'm just wondering, have you done, willingness to pay? Have you launched sort of, is there any opportunity for a freemium option, for example, so that you can get some of those folks over the hurdle and get some traction?
Yes, that is exactly what we are looking into. Right now, we are a premium model as we're still in beta testing. And so the $38 annually is the premium price after we launch our full product. And so we also will still have a freemium option available, just with less content. And then also we don't have those, we're incorporating like 30-day workshops where things are more consistent and you have more access to premium content and premium workshops and stuff like that. So we are still going to be incorporating the freemium aspect and include discounts for people when they refer. So if they want to go to the premium account, we'll be offering discounts if they refer a friend and they sign up for a freemium subscription model at the very least. So we have been looking into that, and people are willing to pay at that price.
Thank you.
Thanks for your presentation, both of you. Really excellent work. I'm just wondering, I'm sure you've thought about, but I wonder if you could talk a little bit about lower income women of color who are, either on Medicaid, don't have an employer-sponsored healthcare provider.
Yeah, I think that's also a great question. I think that's the first thing that came to my mind when I, that's why we want to price it accordingly as well, with $30 a year. We do want to look into providing programs where we're having like additional funding set aside. I know Therapy for Black Girls, they talked to me about a program they have where they offer free therapy to some low income clients. So we're looking into adopting a similar model to create funds, especially for these individuals, and allow them to apply and then be able to give them a free annual membership for 1 or 2 years. So that's something that is really on the forefront of our minds.
Hey, thank you so much. Just one more question from Kim.
Hi there. Is there a community aspect to your app for peers to connect and get together?
Yeah, that's a great question. So that's one of the early things that we were testing. We were sort of wondering, is our product more community-based product, or is it separate from that? So we actually realized that people do appreciate community, but probably more, through social media and also meeting in person. So we do grow our community in that way. Within the product itself, basically the user feedback was that they preferred something that they could work on their own, basically. So there's not the peer aspect in the product itself.
Thank you.